All right, we're talking about muscles of the lower extremity, and we're going to talk about now the muscles that extend the leg. So we got all of our adductors. So let's first talk about the rectus femoris, the quadriceps group. Okay. So we're looking anteriorly. So rectus femoris is the first. Rectus means straight. And so we're looking for an upright, straight muscle. Origin is the anterior inferior iliac spine and the superior acetabular rim. Insertion tibial tuberosity. So let's take a look. So right in front. Can we pull off? Or can we see the origin a little better? Yeah.
Let's do it.
Okay. So when this muscle contracts, it will cause if the knee is bent, it will cause the lower leg to straighten. And it travels with, which is why we call these quadriceps, these two muscles. So those are the next two we're going to talk about. And I like the names of the muscles. Vastus, right? They're vast, they're big. So vastus lateralis and vastus medialis. Lateralis will be lateral, medialis will be medial. So origin of, let's talk about lateralis first. Origin is anterior and inferior to the greater trochanter. And the insertion is tibial tuberosity through the patellar tendon. Innervation spinal nerve. Medialis, origin is the linea aspera of the femur, and insertion is the tibial tuberosity. And vastus intermedius is behind the two that also extends the leg. The origin is the lateral surface of the femur and the linea aspera, insertion tibial tuberosity. So if we look at them in cross section, here is the rectus femoris right in front. This is the anterior. Then we have the vastus lateralis, medialis, and then behind the rectus femoris we have the vastus intermedius. Those are our leg extensors. Next, we'll have our gluteal muscles. So let's talk about the gluteus maximus, the gluteus medius, and the tensor fascia lata. First, the tensor fascia lata. And to really talk about the tensor fascia lata, we have to be able to talk about the iliotibial band. So the iliotibial band is dense connective tissue that travels the entire lateral side of the thigh. And this dense connective tissue is the, or iliotibial tract, you can call it tract or band. This dense connective tissue is the insertion for the tensor fascia lata muscle. So if we look in our diagram, here's the iliotibial tract. But just this part is the tensor fascia lata muscle. And we can see it here. So tightening this muscle will do what to the lower extremity? Right. Now we're on the lateral side, so we're not going to adduct, we're going to abduct. Right, so this will start abduction of the hip. Okay? So origin, iliac crest, insertion, the iliotibial tract. So some flexion, some adduction, and the tract, the whole band, gives lateral support to the knee. Gluteus maximus, origin, iliac crest, posterior gluteal line, insertion, greater trochanter. Huge muscle. That's where we're going to be injecting, right, doing our IM injections, the upper outer quadrant of the gluteus maximus. Because if we inject the upper outer quadrant, then we're missing the nerves and blood vessels. Okay? So if we take off the gluteus maximus, and here's our picture, then we can see beneath the gluteus maximus the gluteus medius, which originates on the anterior iliac crest and inserts on the greater trochanter. So the gluteus medius here has been cut. The gluteus maximus here has been cut. Okay. So anterior iliac crest to the greater trochanter. So we are looking at 12, number 12 here. And here, I can't see the number. Can you see it?
4.
Number 4. Action. What's going to happen when these muscles contract? The hip extends and laterally rotates. You see that?
Yeah.
Mm-hmm.
So we can see contracting here gives us rotation as well as extension.